Jackson is present remotely,
Here.
remotely voting. Commissioner Nelson,
Here.
Commissioner Cavell, we know he's on the premises. Commissioner Kuhn,
Here.
Commissioner Gershenson,
Here.
Commissioner Leaps.
Here.
You have one.
Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approval of the minutes from May 12th and May 17th, 2022. I have a motion by Commissioner McGilvery, support from Commissioner Nelson. All in favor say aye.
Aye.
Opposed? The minutes are approved. We move on to approval of the agenda. I have a motion by Commissioner Hoffman, support from Commissioner Nelson. All in favor of approving the agenda say aye.
Aye.
Opposed? The agenda is approved. We move on to our first public comment for items on the agenda. If there's anyone from the public wishing to comment at this time, please head to the head of the table and state your name and the community you're from. All right, public comment is closed. We move on to communications. There are 9 items under our communications. They're all grant applications in one form or another. Grant application for the WIC Community Engagement Funding. The second one is from Michigan State Housing Development Authority for an education program from the Housing Counseling Services. The third is the Animal Shelter and Pet Adoption Center Intake Disposition Report from April 2022. The next is from the State Court Administrative Office for the Michigan Combat Veterans Treatment Court. Another is a State Court Administrative Office for the fiscal year 2023 Michigan Drug Court Grant Program Adult Treatment Court. And the next one is from the same court for the Juvenile Drug Court. Another grant application exception from the State Court Administrative Office for fiscal year 2023 Juvenile Mental Health Court. A grant exception for the Michigan Drug Court Grant Program. A grant exception for the Michigan Mental Health Court Grant Program. And those are the 9 items under communications. I have a motion by Commissioner McGilvery, support from Commissioner Gershenson. Any comments? All in favor of accepting communications say aye.
Aye.
Opposed? Communications are approved. We move on to our regular agenda items, the first being the resolution approving Area Agency on Aging 1B fiscal year 2023 through 2025 multi-year plan. I have a motion by Commissioner Nelson, support from Commissioner Gershenson, and we have Area Agency on Aging 1B, Katie Wendell, here to speak to this. Hi, Katie.
Hello, Commissioners. Thank you so much for having me today. Appreciate the opportunity to bring our next 3-year multi-year plan before you today. And appreciate the opportunity I've had to work with all of you through the Blueprint for Successful Aging project. Gotten to know a lot of you much better this year as we've worked closely together on that project, which we look forward to continuing. So this 3-year plan outlines the Area Agency on Aging 1B's programs and spending for the non-Medicaid portion of the work we do, funded through the Older Americans Act and State Bureau for Aging, Community Living and Supports, a recent name change at the state for that department. So this rather long plan does respond to those ACLS State Bureau requirements, outlining our intentions for the next 3 years, and then we will update this plan annually. I wanted to note that this is a draft plan. Our board of directors will approve the final plan on June 24th, but the state tightened the timeline for county approval of the plan this year, so we need to get county decisions to the state by July 14th, which is why we're bringing this in draft form, but we do not expect any substantial changes in the plan moving forward. We create this plan with public input, hosting community listening sessions, as well as 2 public hearings in May to gather community input on the plan. Our plan includes information about our agency's response to the COVID-19 pandemic, a couple of ongoing needs that we highlight. There's still an extreme shortage in the number and availability of direct care workers. So for our in-home service programs to work, we need that high quality, well-trained direct care worker to be able to go in the home and provide personal care assistance. And that's a barrier for our programs right now. As well as our provider partners in our public hearings really noted how increased costs due to inflation and, as programs are coming back in person, reestablishing some costs that maybe had been suspended during the pandemic is a hardship. So that's something we're really cognizant of moving into this next 3-year plan. A few of our program development objectives for this next 3-year cycle is to continue to develop resources to diversify our funding to enable us to sustain programs into the future. We are heavily reliant on federal and state funds, so looking for opportunities to provide service in other ways is a priority for us as an agency. We are committed to working with family caregivers who we know provide the bulk of care to older adults throughout our region, making sure they have the resources to be able to manage that workload. We also want to do some outreach to first responders, knowing that they're really on the ground, working with older adults in the community, making sure that they can make the connection to our agency and network as they come across older adults with unmet needs. We're continuing to modernize our programs and services by utilizing technology. We are in the midst of creating a new electronic medical record system expected to launch in December to enhance some of our in-home service programs and ability to refer to our network of services. So that's an investment that we're excited about. And then continuing to do community outreach to reach the diverse population of older adults in our region as that population continues to grow substantially. With that, I wanted to provide an opportunity to answer any questions you might have about our plan.
Katie, do you know how much we pay the direct care workers and what agencies you would contract with?
Yeah, so we do not employ the direct care workers directly. So we contract with in-home care companies to actually hire the worker, and those employers set the rate for the direct care worker. So we don't have a set rate that workers are mandated to be paid through our systems because it's more those local employers that do that. The one piece that we monitor really closely is the $2.50 premium pay wage increase that was implemented during the pandemic. So all workers should be receiving $2.50 above what they were making in March 2020. So we watch that piece, but overall I don't have an exact rate. But our reimbursement is primarily through Medicaid for those direct care workers, as well as our ACLS funded services. I believe the statewide average pre-pandemic was about $13 an hour for those workers. So.
All right, thank you. As much as we have power and control over it, I would encourage everybody to pay the minimum wage of $15 an hour. And I know that does not happen in our local communities who are paid below the $13 an hour. So that's one of the big barriers to providing direct care workers also. Thank you. Any other questions or comments? All right, prompt the vote, please.
Commissioner Hoffman?
Yes.
You have 8 yeas, 0 nays.
All right, Motion carries. Thank you very much.
Thank you.
Our next item is from the Sheriff's Office, resolution approving fleet expansion of one new vehicle for the Marine Division. We have a motion by Commissioner Hoffman, support from Commissioner Powell, and thank you. Welcome.
Good morning. So our first request is, as you stated, resolution approving the fleet expansion. So we've been needing a new truck for the Marine Division for towing and fuel distribution. We originally had it planned in 2021. Obviously, we were still in the pandemic and evaluating things. We carried forward the funding at the end of the year to 2022, and now with ongoing supply chain issues, it looks like we won't be able to get it till the end of the year. So either way, we have to get approval so the garage can go ahead and place the order, and then the budget amendment is moving to 23. So we'll be happy to answer any questions.
Thank you. Commissioner Nelson?
Thank you, Madam Chair. So it sounds like we didn't get additional boats, right?
We're in the process. We have a couple out to bid. The problem is, here's the worth of the boat and the quotes we're getting back. So we've sent it out to bid at least twice now. So we're waiting on those. We're still hoping to get those, but we're in the process of acquiring those right now.
How many additional
Two
boats?
right now is what we've put out to bid. And like I said, the bids we've gotten back are extremely, they're higher than the budget and what we've anticipated paying. So
And it sounds like, so we're not retiring a truck?
No,
There's
this is an
a need,
expansion, yes.
an expansion of
Yeah,
it?
additional towing and the dive boat, with the new dive boat we got a couple years ago is pretty substantial. So this is a heavier duty truck to be able to handle that.
And if I may, we're looking at buying an additional 1-ton pickup truck, and it's going to be used as a fuel truck and maintenance vehicle as well, and this will increase the efficiency of our operation.
Excellent. Given that the truck is being ordered in this fiscal year, why wouldn't this be a part of the 2023 budget?
Well, because this is already in our budget, so we're not asking for additional funding. This is money in our budget that we carried forward to this fiscal year. And so if we could take delivery of it this fiscal year, we just pay it out of our budget. So this isn't the budget amendment you're approving is just moving it from 1 year in our budget to the next year of our budget because of delivery time. But this isn't asking for additional funding. This is already in our budget that we've been planning to purchase this.
Thank you. Thank you, Madam Chair.
Thank you. Commissioner Gershenson, followed by Commissioner Hoffman.
So I'm wondering, do you look at electric vehicles? Is that part of your plan for your upcoming fleet?
We have electric vehicles right now that are hybrids that we're using. Right now, they don't serve the operation as good. We're having a lot of maintenance issues with them right now.
With the hybrid?
But with the Marine Division in towing the bigger boats, we're not sure on the electric vehicle would.
Well, I know there's a lot of American-made electric trucks now,
absolutely,
the Ford in particular, but I would really love to see that included in your plan, is to be sure and get the pricing, because we are going to be expanding the charging stations, and we'll be getting a lot of more federal, state money to really elevate our use of electric vehicles.
And I know that's an ongoing discussion, so the garage is obviously working with the county sustainability officer.
Great.
So that is an ongoing discussion. So at whatever point in time that works for us, then I'm assuming
Okay,
that
that's
we'll
good to
move
know.
in that direction. So
Great.
yes, that's,
Commissioner Hoffman.
Thank you very much for being here. Is the workload of the Marine Division increasing because you're getting more contract work with more municipalities, or is it pretty much same amount of work?
well, we did add Cass Lake this year, so we have that additional agreement with Kego Harbor. And so we're managing with the same amount with additional hours. Last year, we had the No Wake grant, so it's about the same.
Okay, thank you.
Commissioner McGilvery.
Yeah, I'm just curious about incidents on the lake. Has there been an increase in incidents on the lakes? Is
Well,
that-
luckily, this year so far, we've been very fortunate. Everything's been going smooth. Cass Lake's been going smooth. We got a couple compliments from Kego Harbor and the DNR for additional support on Cass Lake. We haven't had really any issues. We just recently had a drowning on Kent Lake at the Metro Park that our dive team responded to assist.
Okay. Have we added any new lakes other than Cass Lake?
No, that was the newest one this year.
Okay. Thank you.
We did recently get a request for some fireworks events on some other, in some other areas where that's in the process. We're working on that right now.
Okay.
Commissioner Nelson?
Thank you, Madam Chair. Just as a point of clarification, I know reference keeps being made to Marine Patrol and Cass Lake. Is it Cass Lake or is it 400 feet of Cass Lake?
Well, it's, yes.
I just want to be clear because Cass Lake is a very large lake and it's a misconception when we say we have Marine patrols on Cass Lake when really it's 400 feet of a lake shore. So
Well,
it
it's with
sounds
Kego
like-
Harbor, right,
But
so
it
it's
sounds
the-
like
the
400
agreement,
feet of
yes.
Cass Lake is only being patrolled. Is that fair to say?
That's what Kego Harbor has requested, yes.
Thank you.
Anything else? All right, prompt the vote, please.
Commissioner Hoffman? You have 8 yeas, 0 nays.
All right, motion carries. Thank you. Don't go away. Our next item
Nope, we-
is from the Sheriff's
We're-
Office, grant acceptance with the Michigan Department of Treasury for the 2022 Law Enforcement Distribution Program. I have a motion by Commissioner Hoffman, support from Commissioner Gershenson. Thank you.
Okay, so this is our annual, the first installment of our annual distribution from the Michigan Commission on Law Enforcement Standards, MCOLS. It's about $27 less than we got at this time last year. I think we mentioned last year that historically we would get, or the last several years, we got about $50,000 in each distribution. So obviously because of all the court fees and everything else have been lower, then our distribution is lower as well. But this is our annual, one of our annual distributions that goes towards training.
Comments or questions? Prompt the vote, please.
Aaron, my screen went blank.
You have 8 yeas, 0 nays.
All right, motion carries. Thank you. Item D from the Sheriff's Office, grant acceptance from the Michigan Department of Natural Resources for the 2022 Marine Safety Program. I have a motion by Commissioner Nelson, support from Commissioner Powell. Thank you.
Okay, so obviously we brought the application to you a short while ago for the marine safety grant this year. We applied for the 451, a little over 451,000, and were awarded 166,600. It's just a little under $8,500 less than our award last year. So a portion of it is state, 78,000, and 88,600 is federal funding, and they didn't give us any funding for equipment this year, so. It's just offsetting salaries and operating costs. So we're asking for your approval to accept the grant.
Thank you. Comments? Prompt the vote, please.
You have 8 yeas, 0 nays.
Motion carries. Thank you. Thank you. Next item from the Sheriff's Office, an interlocal agreement with the Charter Township of Independence. Amendment number 1 to the 2022-24 Law Enforcement Service Agreement. I have a motion by Commissioner Hoffman, support from Commissioner McGilvery. Thank you.
Okay, so Independence Township has approved and requested an additional deputy position to be added as a school resource officer effective August 13th. So starting just before the start of the school year.
Thank you. Any comments or questions? A roll call, Commissioner DeBelle?
I'm going to be voting no on this because we know that police respond to crimes, they do not prevent them. We know that prevention is the best answer. This is the wrong direction to go for policing.
But I would like to say in the communities I represent, we have a school liaison officer who builds a rapport with the children and students. And I would consider that preventive measures because they do talk to the school liaison officer and people know who they can approach for support and help. Commissioner Hoffman?
Thank you, Madam Chair, and I just have to echo what you say. I mean, these are contracts negotiated between the Sheriff Department and Independence Township. They know what their needs are. I think to have a liaison officer there, I think, is being proactive.
Commissioner Cavell?
No matter how nice a police officer is to someone, does not change the fact that they might have economic pressures or societal pressures or mental health concerns. Doesn't matter how many nice people are being nice to you, if those still exist.
I didn't understand that, but we could talk later. All right, anything else? Prompt the vote, please.
You have 7 yeas, 1 nay.
Motion carries, thank you. Our next item from the Sheriff's Office is a grant application with the U.S. Department of Justice Bureau of Justice Assistant Program for fiscal year 2022 Bulletproof Vest Partnership Program. I have a motion by Commissioner McGilvery, support from Commissioner Hoffman. Thank you.
Okay, so this is our annual application for bulletproof vest reimbursement. We are on a 5-year replacement plan, so we ask for about 220 vests a year, which is where they're $505 a piece, which is where we got the 111,100 that we're applying for. Historically, we haven't gotten that much. Last year, we got enough to purchase approximately 42 vests. It fluctuates year to year. Some years we get 0, some years we get, what feels like a bonus, but obviously we have to replace them. So we're just applying for the max that we are eligible for.
Thank you. Questions? Prompt the vote, please.
You have 8 yeas, 0 nays.
Motion carries, thank you.
Thank you
And
for
that
your
was your
support.
last item, thank you.
That's it, quick.
All right, next item is from Public Services Community Corrections, donation acceptance of 2 naloxone vending machines. I have a motion by Commissioner Nelson, support from Commissioner Gershenson. And we have Eric Schmidt here to add more information about the donation of 2 vending machines in 2 different locations in Oakland County. Welcome.
Yes, thank you. Can everyone hear me?
Yes. Yes.
Great. Yes, as you have before you, Community Corrections is looking to have the county accept 2 naloxone vending machines. As most of you are aware, the overdose fatalities are a national and a local crisis that can be mitigated through harm reduction strategies, and that individuals that are leaving incarceration are many times more likely to suffer from an overdose, a fatal overdose, in the 2-week time frame after they leave incarceration. And so Community Corrections obviously provides programming and support to these individuals that are being released from the jail. And we are looking to help reduce the fatal opioid overdoses by including these machines into our harm reduction strategies. The FDA has approved the naloxone as a medication that is nearly 100% effective in reversing effects of the opioid overdose, and yet it is not harmful if it's administered in a situation that is not an opioid-related overdose. We are looking to accept these machines from the National Center for State Courts. They're looking to donate these machines that are roughly $5,000 in value each, and they are receiving them from a grant to the Federal Bureau of Justice Assistance Comprehensive Opioid Stimulant and Substance Abuse Grant Program. We will be receiving our naloxone kits from the Michigan Department of Health and Human Services, and those are determined to be not donations, actually. So, and we'll be placing these machines at our 2 locations where we have our Step Forward program. So one of those would be in the Oakland Point office here off Elizabeth Lake Road, and the other would be at the South Oakland office. at 1151 Crooks Road. There is no obligation on the county or cost to be incurred except for maintenance of the machine. And if at any point we decide that we want to cease the distribution of naloxone kits, we are free to do so with no harm or penalty. So with that, I'll leave any questions.
Are the kits themselves good for 1 year? And who would replace those kits after a year or when they expire?
Right, so we intend to work with Michigan Health and Human Services, or Human Services, excuse me, to facilitate those kits in the event that they do indeed expire. So we will be able to work with them. Secondary source is also through Wayne State's program there.
Okay, thank you. Any other question, Commissioner McGilvery?
How did we determine that these are the most important locations to put these machines?
Well, right now we have a kit, or excuse me, a machine that is located outside of the Oakland County Jail. And at this time, when we're looking at our community corrections services, I was hoping by this point, and actually the machines will still, once we confirm that they've been accepted, machines will be actually built and then distributed to whatever mailing address that we choose. So we can place these anywhere we want in the county. When looking at the criminal justice involved population, I felt that it was important to have these machines located where we provide our services. I thought by now, with the COVID numbers going down, that we would be returning to in-person service delivery here at Community Corrections. We have yet to start doing so, but I'm hopeful that we will, and so that individuals who are on probation, either through the state or through district court, will have and know about the availability at these two locations. There's also a drug testing entity through the sheriff department located at both of those locations. So right now, that's where I've identified. The health department is also working to obtain machines where they will be placing them, I would assume, in their health stations where they deem to be fit throughout the county. So this is likely something that will be increasing.
One additional question. What is the cost to fill one of these machines? And do the people have to pay to get into the machine, or is it just open it up and grab what you need?
Right, the machine is basically, you press a button and there's a picture of the machine in the kit that was distributed, in Civic Plus. And so there's no money associated with the individual that's looking to obtain the kit. They simply press a button on the machine and it distributes its content, or the one kit, which can be 1 dose or 2 doses. The kits themselves vary in cost. They're roughly $100. But again, those are being distributed through the Michigan Health and Human Services.
That adds another question then. What's going to prevent someone from, if they need a Narcan at home, just going to one of those machines and taking it whenever they want at a cost of $100 a piece?
Well, the idea is to make them obviously available at no cost to the community. So you may have a loved one who may have an opioid issue, or if you were just simply wanting to be preventative as a community member, where you may end up being somewhere where someone overdoses, that you could distribute that equipment. That is the goal of these organizations that are looking to make these kits available. So they are incurring the cost, not the county, and they are happy to have those be taken by any individual in our community that feels they may need that at any time for either a loved one or themselves.
I would like to say ACHC in Oakland County has community coalitions in each city, village, township, and they offer free naloxone trainings frequently. I have 2 kits at home and 1 in my office desk because I take them. You take the training, which is not a lengthy training, shows you how to use it, and you get a free kit. So I think they're valuable for everyone. So other resources are out there. I'm fascinated by a vending machine to dispense that. So I'm happy to see vending machines around and about. Yes.
I don't disagree with
Yeah.
you. I'm just worried about the ongoing costs at $100 apiece if someone decides just to come in and take them. That's at our expense. That's what I'm worried about.
No, we're not paying for the naloxone kits, are we?
We are not, no, they will be free to the county.
Okay.
Commissioner Nelson?
Thank you, Madam Chair. I want to kind of piggyback off of one of the first questions that Commissioner McGilvery asked and about location, right? Are these vending machines available 24/7, or are they held within the buildings that are, open to the public 8 to 5?
Right, so both these locations, they would be inside the building, but they are open 7 days a week. So our community corrections offices are open until 7:30 at night, Monday through Thursday, and then till 5 o'clock on Friday. And then on the weekends, the building is open, that mirrors the Oakland County Sheriff's Department results testing program. So the building is open, I believe, until 1 o'clock on Saturdays and Sundays.
Thank you. I think this is a great start and a really great initiative. I'm hopeful that as we move forward into the future, that potentially we could get more of these vending machines within our communities that are available and accessible 24/7. So I do appreciate and I will be supporting this. So thank you.
Thank you.
Thank you. Anything else? Prompt the vote, please.
You have 8 yeas and 0 nays.
The motion is carried. Thank you.
Thank
Thanks for
you.
joining us. Our next item is from Emergency Management and Homeland Security, a grant acceptance from the Michigan Department of State Police for the fiscal year 21-22 Hazardous Materials Emergency Preparedness Planning. I have a motion by Commissioner Nelson, support from Commissioner Gershenson. And we have Robert Seeley here to add any information to this item.
Good morning. This is an annual grant that comes in from Michigan State Police. It's the Hazardous Materials Emergency Preparedness Planning Grant. This pays part of the salary of one of our employees who uses a program called Tier 2 Manager in order to follow the emergency preparedness of companies that produce hazardous materials in Oakland County over a threshold quantity that is given to us in a document called the list of lists that comes from the Emergency or Environmental Protection Agency federally. They are required to report any spills or any incidents, and companies are required to have an off-site emergency response plan with their local fire departments and police departments, so that if they have a major spill, the fire and police know that what chemicals are at the location. It's a part of the Firefighter Right to Know and Community Right to Know Acts, and this is the community upon request. The amount of the grant is for $14,000, and of that, $2,888 is a match, which we cover with the salary we pay to the one employee. That employee used to be a part-time employee that worked just in emergency management, and then this last year, that position has been turned into a full-time employee that does this, as well as works in our badging area and makes badges for county employees. So they're now a full-time employee.
Thank
So
you.
that is the question.
Comments or questions? All right, prompt the vote, please.
You have 8 yeas, 0 nays.
Motion is carried. Thank you.
All right, thank you very much.
Thank you. Our next item is a resolution confirming the 2022 medical marijuana operation and oversight grant acceptance from the Michigan Department of Licensing and Regulatory Affairs This is an annual grant acceptance of $454,786 used to develop messaging efforts to increase awareness of health and safety risks of medical marijuana via paid advertising. I have a motion by Commissioner McGilvery, support from Commissioner Nelson. Are there any comments or questions on the grant acceptance? Commissioner Nelson?
Thank you, Madam Chair. In regards to this specific grant, do we know if there's going to be any funds that will be utilized for lock boxes? I know that we've had some conversations over the past couple years in taking a look at some of the preventative measures that individuals can take in their homes. And I know we've talked in great length in the past about lock boxes. There's been other counties, not just across Michigan, but across our country, who have done some really great programs in regards to providing lock boxes. So I was wondering, is there anyone here today that could maybe give any insight or update on will any of the funds from this grant go to those preventative measures such as lock boxes?
But the funds I see are for positions, but I'll ask Leanne Stafford if she has any additional, yes.
Oh,
come to
sure.
the
That'd be great.
microphone.
Thank you.
And I do know that, once again, our coalitions have lock boxes that are small, so I know if someone broke into my home and took this lock box that the coalition dispenses, instead of trying to open it, they just take the whole lockbox because it's, yeah.
Sure, and a lot
That's
of the
small.
purpose and reasons behind the actual lock boxes is for children, right? So out of the hands of children and stored in a more safe manner, but completely understand that, Madam Chair.
Thank you.
Good morning, everyone. Yes, so one of the activities for this grant would be purchasing lock boxes. We're also working on a survey to talk about medical marijuana card holders and the things they also need, but one of those items on the activities would be to purchase lock boxes.
Excellent, I appreciate that.
Yes.
I'm happy to hear, so
Okay.
thank you.
Yes, thanks.
Any other questions? All right, prompt the vote, please.
You have 8 yeas, 0 nays.
All right, motion carries. Thank you. Our next item is from our Health Division, a grant application with the United States Department of Agriculture for the fiscal year 2022 Prescription for Healthy Living. Then this has been a popular program in the past prior to the pandemic, but we'll see what happens now. I have a motion by Commissioner Nelson, support from Commissioner Cavell. And welcome. What would you like to add to this?
Yeah, so I also have Carrie Rabar with me. She's a supervisor over at the Health Division, which oversees this grant. So this is a continuation grant. So we've had this grant over a few years, but there's a new funding source that will allow us to also expand throughout the county. So there was a big focus in Pontiac, and then we also had an additional grant that focused on the southern part of the county. But now this grant, which is just over $400,000, will allow us to expand this throughout the county, so all areas. It's a 2-year grant, which is great. That allows us, a little bit more activity and leeway to get some of the programming done. And we will be staffing 2 people, health educators that really get into the community and do this work, especially at that ground level. And so, it's been a great program. Carrie's been working hard on this. I know Commissioner Gershenson has been an advocate of this, so we'll continue, if we accept this grant, to move forward with this work.
Thank you. Comments or questions? Commissioner Powell?
I have a question. Who will be point of contact to talk about, like helping with health initiatives in the local municipalities? Is that Calandra?
It is Calandra,
Okay, I'll
yes.
get with her.
Okay.
Okay, thank you.
Any other questions? All right, prompt the vote, please.
You have 8 yeas, 0 nays.
Motion carries. Oh, don't go away.
Chairs a little bit.
Our next item is from Health and Human Services grant application with the Michigan Department of Health and Human Services for the fiscal year 2023 Local Health Department Comprehensive Agreement. I have a motion by Commissioner Cavell, support from Commissioner Gershenson. What can you add about?
Okay, so this is our large mandated services grant that we receive. So this is our wells, our septics, our restaurants, our WIC program. So this application is really the funding that we receive from MDHHS. For those that have been here a little bit, you've heard it CPBC. Now we call it the Comprehensive Agreement. It's just under $12 million. So really, they kind of tell us the funding that we're getting, and then we apply for it. And then once they indicate or agree to the amounts that we've applied for, then they'll accept the grant, and we'll bring it back. This does fund 56 special revenue positions. And unfortunately, the state has taken on a couple of, they're centralizing a few of the programs now at the state level. So some of our HIV services like data to care will now be handled at the state. So that's where you're going to see the fluctuation in funding.
Thank you. Comments or questions? Prompt the vote, please.
You have 8 yeas, 0 nays?
Motion carries. Thank you. Our next item is from Health and Human Services, a resolution appropriating American Rescue Plan Act local fiscal recovery funds for the Healthy Food Access Initiative. Who would like to make a motion? I have a motion by Commissioner Gershenson, support from Commissioner Cavell. And we have Ken Dobson and Carrie back to speak to this item.
Yep. Good morning, Madam Chair, members of the board. The Healthy Food Access Initiative is a one-time grant opportunity to provide Oakland County emergency food providers with the funding that is needed to meet the greater need at this current time. The initiative will be divided up in 3 parts. The first part, $350,000, will go to Lighthouse, which is Oakland County's largest emergency food provider. The second part of the grant will be $150,000 that will go to Oakland Hope, which is Oakland County's largest choice for, pantry. The third part, the Oakland County Health and Human Services Department will contract with the Pontiac Community Foundation in the amount of $350,000 to provide grant opportunities for smaller emergency food providers and will allow them to apply for grants up to $50,000. The Pontiac Community Foundation will also handle the request for proposals. They will review the grant applications, the portals, the scoring rubrics, and they will do all the review and provide those recommendations back to the health department on how to proceed. So that is that initiative, and we are here to answer any questions.
Okay, I do have a comment, and I don't know whether it's here or there. Our next item is for a food landscape study. So but the item we're talking about now is appropriating money for the 3 food groups. Okay, all right.
Madam Chair, if I could clarify, so this program will provide emergency food for residents that are in need now. The food landscape study will give us the data and information that will be needed, the strategic data and information that will be needed that will allow us to have a plan to handle food insecurity issues in the county on a longer-term strategy.
Thank you. Commissioner Powell, followed by Commissioner Gershenson, followed by Commissioner Cavell, followed by Commissioner Nelson.
What was the amounts again of the 3?
The total amount, Commissioner, is $850,000. It is $350,000 to Lighthouse, $150,000 to Oakland Hope, and $350,000 to the Pontiac Community Foundation, who will provide grants to smaller emergency food providers in Oakland County.
So when you say smaller food emergency groups, give me an example of who would that be?
You want to answer?
Hi, can you hear me? All right.
Yeah.
I'm Melanie Grund. I work in neighborhood and housing development. I know Angela knows me. It would be for anything from an operation like a hospitality house, which is a current food provider, or an organization like Affirmations, which provides food but isn't technically a food provider, to Oakland University's student pantry. So it allows for a little flexibility in getting food into the communities.
Got it. Okay, my second question is, I know we was going after some more funding for other things with Oakland Hope. Is this separate, or is this going to be additional to that discussion that we still have on the table with Oakland Hope?
It is my understanding related to Oakland Hope for this is the amount that was decided based on their budgetary needs and for what they need at this time.
For emergency food.
But you all are aware that we have another discussion on the table that was supposed to include this type of, like, under that umbrella as well. So is this additional, or is this just gonna carve out to be separate, and then we'll have the discussion and talk about everything else Oakland Hope had talked to us about?
Yeah. I'll go.
Yeah. This money is intentionally for food in times of, because first of all, the COVID numbers, secondly, the cost of groceries, as we all know, and availability of, and then gas is also affecting these providers. So this is a carve-out specifically for emergency food support. The rest of the discussion would have to be had separately from this. because
Got
it's
it,
meant
okay, I just wanted that clarity on record. Thank you.
Commissioner Gershenson?
Thank you. So how was the 850,000 determined?
The first amount from Lighthouse, they actually requested at a specific amount of dollars. After reviewing their budget and looking at the need that they have and the people that are serviced, we came to that amount.
Okay.
That would be best for them. With regards to Oakland Hope, again, we reviewed their need and the budget for emergency purposes. That was the amount to be determined for them. The 350 for Pontiac Community Foundation, we just did, we did research on how many organizations would be out there, how many who actually would have the ability to distribute dollars. And, you know, we just did an estimate for them and came up with the 350.
Okay, so there was a plan behind that figure.
Yes, it was.
That's good to know. And when you say this was for organizations with an operating budget under 20 million, is that in the guidelines? Is that in the?
Yes.
Okay, so that was a prerequisite for. And so Pontiac Community Foundation will run the program, and then we will be getting quarterly reports, so we'll know how much they use, if they use it.
Yes.
Okay, thank you.
Yep.
Commissioner Cavell?
I just want to say this is great to see. Good job, everybody. I've been talking with some of these organizations, and they've been talking about the food crisis for months. And you know, in Oak Park, there's every Wednesday morning a drive-through food pantry that comes to City Hall, and the line is still around the block. So this is very much a real issue for very many people. So appreciate you.
Thank you.
Commissioner Nelson?
Thank you, Madam Chair. Just a couple questions. So Pontiac Community Foundation, Oakland Hope, amazing organizations. I'm glad that Commissioner Gershenson asked about the amounts. I'd like to put even more money to this initiative, right? This is an important initiative. My first question is, was Gleaners or Forgotten Harvest offered an opportunity? Why those two specific organizations, given we've worked in the past with Gleaners and Forgotten Harvest? So how did we come to Pontiac Community Foundation and Oakland Hope?
I think we were looking at providing support to like smaller food pantries and getting money straight to them to be able to distribute more quickly. And I think, you know, there could be continued conversations with Gleaners or Forgotten Harvest, but this we were really looking at those food pantries that are more embedded in the communities.
Didn't you say, though, just as clarification, that it's the largest? Did I not hear that?
Lighthouse.
Oh, Lighthouse.
Lighthouse.
So Gleaners and
Lighthouse.
Forgotten Harvest are
Lighthouse.
different in that they're
Yeah.
more food, you know, food hubs, food distribution
Distributors,
hubs,
yeah.
food distributors, and so these are more the emergency food providers on the ground in the communities.
Excellent. And my final question, Madam Chair, is, so given that this resolution is utilizing the ARPA funding, has this been approved by Guidehouse? If so, are those documents attached? Is there a matching grant component to this resolution, and is there a sustainability plan after this money runs out?
The applications have been approved by Guidehouse, both the initial project summary and the full summary, and Guidehouse is actually in the process of completing the actual official eligibility document. So it has been fully vetted and approved by Guidehouse. With regards to your next question was, Commissioner, I'm sorry.
Is there a matching grant component to this resolution at all?
No, there isn't a matching grant component tied to it. And I think your last question was based on reporting.
Sustainability plan? After the money
Sustainability.
runs out?
Well, this is a one-time grant. This is a one-time grant opportunity. So these organizations have to utilize these funds to the best of their ability.
Excellent. And to go back to the first, the guidehouse approval, are those documents attached to the agenda?
No, these documents aren't attached to the agenda, but I could get them to if you would like
That
to
would be
review
great.
them. Yeah.
Thank you.
You're
Thank you.
welcome.
Commissioner Powell?
Chairwoman, it's Commissioner Jackson. Could I speak?
Commissioner Powell will speak first, and then you'll be able to.
Is it safe?
All right, thank you.
Actually, you just missed McGilvery. He was before
Oh,
me, yeah. I'll go after
Commissioner
McGilvery.
Thank you. I understand this is a real needed in the community. But I find it difficult to understand, while sometimes we have to come up with a complete plan. This is the first time I'm seeing this, before the money can be appropriated. For example, Parks and Recreation asked for money, ARPA money. They had to come up with a plan first before any money was appropriated. This is the first time I'm seeing this, first time I've heard of it. I guess I would have liked a little bit more communication as to what was going on. So with that, I'll be voting no on this, although there's a big need in society for this.
Okay.
Commissioner Powell?
Is it safe to say that these organizations already kind of have partnerships with Gleaners and they like receive food from them? Yeah, I just
Absolutely.
wanted Commissioner Nelson to know that as well, just in
Yes.
case. That most of these organizations already work with either Gleaners or, and then I'll let you know, at least in Pontiac, Gleaners, and what was the other one you said? Forgotten Harvest. Girl, they everywhere in our city. So they got setups too, just so you know. Thank
Madam
you.
Chair, if I
Commissioner
may.
Jackson?
It's right out of my mouth. I know for a fact that the Lighthouse uses Gleaners and Forgotten Harvest as partners in distribution and packaging and getting food out to the residents of our community. And in the vein of what Commissioner Cavell said, as far as just the need in the communities is just increasing as we see. And I know in my city, Southfield, which I represent, we have several senior citizen facilities that have gone from assisted living to an independent living model where they no longer provide food. And the seniors are suffering hardship because of this change of status. And Lighthouse came into the facility and directed their services to help the seniors with food. So we have also an opportunity as commissioners to go out to our community and look at the individuals that might be struggling, especially right now, and point them toward Lighthouse. So I really appreciate their efforts in this whole funding process, because right now we know we're in a food crisis. Thank you.
Thank you. Any other comments? Commissioner Cavell?
Just wanted to lift up what Commissioner McGilvray said. The communication's important, right? So I appreciate what you're saying, Gary. So yeah, next time feel free to call if the bosses allow. But yeah. And also, Forgotten Harvest got $15 million from Mackenzie Scott. So they don't need our money.
Any other questions? And I do want to say I understand Commissioner McGilvery's point regarding the other appropriations for American Rescue Plan money, is that we don't seem to have a set standard for each
Process.
request.
No.
Yes. That each request comes through a different person regarding their relationship, however it happens, but the circumstances, the situations are different for each person who asks, and I think that's to Commissioner McGilvery's point. Commissioner Nelson?
I just want to piggyback off that because that is frustrating, because we have a lot of agenda items after this that are ARPA dollar funding as well. And there is and has been an inconsistent process and an inconsistent standard. Communication and collaboration is essential. And it has been disappointing. I'm not gonna sit here and say that it's been a great process. It's been very disappointing with the lack of coordination, collaboration, and communication in regards to ARPA resolutions. I know, Ken, you've been amazing with answering questions along the way, but yet I still feel like we could still do better at communicating, coordinating, and collaborating with each other.
Sure.
Madam Chair, so as this process has gone on, we have developed a process now where there is a process where you could receive an initial eligibility form, which this is if you have an initial idea, which you can submit to the office, which we will work with you and let you know if the project is eligible or something like that. If it is, there's a second document called the full project summary that you could submit. You know, our team will be happy to help you work through it, answer any questions or anything like that. After the full project summary is submitted, there is a 7-step, where it's part of a 7-step process where then you would go to purchasing and corporate counsel and things like that. So as ARP has grown, we have developed what I would consider a 7-step process to help identify the steps along the way for projects that want to be considered or reviewed or something like that. And feel free to call me at any time. I would be happy to, I've spoken with a lot of commissioners. I will be happy to guide you through the process. I will be happy to provide both forms with you and answer questions, with Guidehouse or even Pearson Monroe if you have reporting questions, to give you an idea if your project or your idea is eligible, and if it is, to make sure that we keep it moving and get it approved so you guys can decide what happens to it.
Thank Commissioner Nelson.
Thank you. Just to ask a quick question. So is the initial eligibility and project summary document for this resolution attached to this agenda?
No, it's not attached to this agenda.
Okay,
Yep.
thank you.
Commissioner Gersonson.
So I would also like to weigh in. This process during the first year was new to everybody, very frustrating to many. But as we communicated with your team and your team better understood their guidelines, for me personally, the communication has improved. But the issue, Ken, is not how we put forth, it's how you put forth to us. So we're putting forth ideas to you that are vetted, you know about them ahead of time. We're getting resolutions that we've never seen before. So I would suggest that we take it another step further and just try to develop some mechanism that addresses that, because these are all great ideas. They're new ideas to us. So, but then again, the committee is the area where we're supposed to be discussing and working on those. But I do think there is one more step we should try to develop, which is how you communicate back to us.
Thank you. Commissioner Cabell.
Just real quick, and all this is to say, it's for someone else, not you. I know we're doing a lot of this, but it's not
That's
for
okay.
you, because you guys
That's
are doing
all
great.
right.
Okay.
Commissioner Powell.
So would it be, Marcia, is it like maybe us requesting that we possibly could get a grant, not a grant, like a little short summary of things that they are potentially working on that may come before us, so we have a synopsis of it before it is a full presentation before us? Is that something you trying to get to be suggested for leadership over there to kind of consider?
Yeah, I think
Okay.
they should hear what we're saying, and then they should come back with some sort of idea. I know Sean was kind of overseeing everything. I don't know if that's still happening, and that maybe he could reach out to our leadership, and we could just see how we could address the concern of Commissioner McGilvery, where,
even if it's just potential projects, right? Like, okay, this is stuff that's coming down the pipeline, that's up of discussion over here. Just want to kind of let y'all know that this is coming and it may come before y'all. Not saying that it's fully vetted and may get approved, but if it's something that y'all know that y'all looking to strongly approve, somehow we work that out with leadership.
I think I can share that from the leadership.
Would you come to the
Thank
end of
you.
the table, please?
Good morning, Madam Chair. From a leadership standpoint, I'm definitely committed to, being very transparent about, what's coming down the pike. I think I've probably worked with each and every person around this table, on an ARP project. I try to, I would like to have like, meetings where I'm letting folks know, particularly if you're interested in, a particular issue. I'm really big on saying, hey, Marcia, I got this issue I'm working on. Do you want to take a look at this? Charlie knows about housing, right? Worked with a lot of mental health stuff with, folks around this table. I'm more than happy to set up a structure where that, if we're working on something and I think it's going to be coming your way, or we're starting to draft a resolution, to send something to Madam Chair. Madam Chair can then get it out to the committee. And if there's any questions, our team is very happy to field questions and, provide insight and feedback.
Is that one large committee still going on where we did have commissioners serving on that? I know like Dave was there, but see, if you all are still having those type of communications, okay, it's not happening.
I think it's kind of been like, falling off into,
okay. Because I was going to say, if y'all having that big meeting, it could come back to us.
If you're passionate about food in Pontiac, I'm going to pick the phone up and call you. If you're passionate about, mental health, then I pick up the phone and I call Penny, or I call Christian, or I call Marcia.
Okay. So it's been case by case.
Yeah. So and then like with the housing piece, Charlie expressed a lot of interest in it, and we met almost weekly. With Charlie, it's like almost daily. But we met a lot to discuss that issue.
So
and I'm more than happy to do that.
So I think if you go about it that route, then it'll charge us as commissioners to make sure that because he knows specifically what we're interested in, and if that conversation, I know they're gonna figure it out, but I think that is a good avenue
I know we're
too.
not here to kind of formalize a process right now, but I would prefer from a leadership perspective to work through Madam Chair.
Oh, got it.
And Madam Chair could say, hey, you know what? You can work with Charlie on housing, Rudy.
Right.
Or Rudy, with delayed learning, go work with Marcia, please.
Got it. Okay, perfect. Okay, good.
And also,
Commissioner Cavell?
sorry, thank you, Chair. Also, Rudy brings up a good point, which is he is very accessible. We text all the time. It's awesome. So reaching out also helps on our part, right? So for our part, and Rudy's good at communication. Just personally, he'll tell you when he doesn't want to talk. So that's very nice. But so we can reach out also, and I think it is in our board packet, so we could look.
Got it. Don't tell on everybody.
But I think the piece is we receive our packet or the agenda's posted with the packet of information a few days before the meeting. So with the number of items on this agenda today, it may be difficult to absorb and really get your thoughts together for
And
it.
it's too late, right? I get you. Understood.
Anything else? Commissioner Nelson?
Thank you, Madam Chair. Just lastly, I appreciate all the information that's been shared. I will be supporting this initiative today, but I do have some additional questions and concerns that aren't necessarily related to this specific, but it does have a relationship with it, given that it is ARPA dollars. So I just want to be clear that I do support it today, but I do have some questions that I would like to gain additional information on as we lead into a board meeting if this does pass out of committee.
All right, thank you.
Thank
Anything
you.
else? All right, prompt the vote, please.
You have 6 yeas, 2 nays.
All right, motion carries. Our next item is from Health and Human Services, resolution appropriating American Rescue Plan Act local fiscal recovery funds for a food landscape study. So I have a motion by Commissioner Cavell, support from Commissioner Bershenson. And what would you like to add about this item?
Okay. As I mentioned just briefly, Madam Chair, when we spoke earlier, the food landscape study will provide Oakland County with the data needed to develop a strategic collaborative plan to support people who need food assistance. The food study would give the county and our stakeholders and partners a tool to develop a services model, best practices, innovations and outcomes, so that we're making sure that we're providing food in a strategic and efficient manner. A third-party vendor will be contracted to perform the strategic assessment and provide the county with a comprehensive action plan. This vendor will also work with the University of Michigan Poverty Solutions Center and Ford School of Public Policy to provide the county a comprehensive action plan and recommendations to improve the healthy food access for Oakland County residents.
Well, would you work with DHHS, Department of Health and Human Services, who would oversee the Medicaid or Bridge program, what we used to call food stamps available to families? It seems to me that would be the point where you would find low-income families who are in need of additional food.
Sure. The food landscape study, you can think of it as an assessment, that is what it is really a comprehensive tool to allow us to look at healthy food system, which can be everything from the emergency food and the SNAP benefits, WIC, et cetera, that we're used to, pantries, et cetera, right? But it can also be local food processors, which allows us to not be, Michigan's a pass-through state, so they have to intentionally come here to deliver food. If we had local food processors, that allows us also economic development, of course, but the need is a little bit less. It can work with farmers. So it really is an assessment from the user, the farmer, the providers, whether they are county-centric or someone like a Gleaners and Forgotten Harvest, and of course our friends at MDHHS and MSHDA, frankly, because we are working with them on the nexus of food and housing security as well. So it's incredibly comprehensive, and thus why we are not doing it ourselves.
Thank you. Commissioner Gersonson?
Well, I appreciate that, because it's always hard to put money into a study because so many studies don't do anything when you get the information. But we've got so many agencies that are working on this issue that to kind of get a comprehensive view and then analyze what is working, what isn't working. So this goes through the end of ARPA funding, is that correct? So there isn't going to be any report update. This is a year to 15 months that they're going to be working on. So that'll take us pretty much to the end of ARPA. So we really, we won't be getting any updates on the study as it proceeds.
Well, I think we can work in, I mean, it's not that I would anticipate someone from the board will participate with us as well. So I'm hoping that you'll have those updates as they go through. But no, you won't have a finalized product. You won't have, there isn't quarterly reporting because it is information gathering, focus groups, et cetera. So I guess yes and no.
Well, and then you see yourself, the health department, taking action because it will be from our budget. It won't be from ARPA. ARPA is just funding the study. So the actions that are taken will be coming from our budget in the future.
I think it could be a comprehensive plan that like partners work on together, you know, we can work with our community partners and then each kind of identify places that they could lift up and help implement.
Yeah, the idea is not, it's leveraging partnerships, it's leveraging other grants that might be available, it's how can the county best support, which might be a much simpler role than we anticipate. It could be data, perhaps we support in that. So it really is to give us, we don't know. There's a lot of nuance in the food system in Oakland County.
Right, and as I said, sometimes in the past, the commissioners have had a hard time accepting, why are we giving an agency this amount of money to do it? Why aren't we doing it ourselves? So I think you've explained well that this is a very complicated system, and it's time that we understand all the components. So I do support this.
Thank you. The idea for a study originated from somewhere. So what would one item that you would suspect may come out? Well, I know the outcome is a study, but what do you want to see happen? What do you expect to happen from the study? What do you want to be different? Because the idea had to originate from someplace.
Madam Chair, what we want to find out is a couple things. One is, what is the exact need for food in Oakland County? So that is one, what is the need? Who needs it? Where is the need? And then we need to discuss recommendations on options on how best to get food to those areas and doing it in an efficient manner.
Or could I back up what you're
sure.
saying? It's not just the emergency food aspect of it. I think that's important to understand as well. Sometimes a food box, so you probably all saw the FEMA boxes or Q boxes as an example during COVID. We sometimes have conflicting data on a box could be counted 3 times within the county, but that doesn't mean we need 3 times. So because there are different reporting mechanisms, I'm just looking at emergency food as an example, because there are different reporting mechanisms for different providers, we don't necessarily have, so it makes it harder to make an assessment on, say, the emergency food grant.
Thank you.
I think there's a need for a coordinated approach, and this is what this will allow us is it will provide the data so that we could have a coordinated food strategy, just understanding the food landscape with our partners on exactly what's needed in Oakland County and how we could best provide the services.
Thank you.
Yep.
Commissioner Powell, did you have your hand up?
Did you all decide the vendor who's gonna orchestrate this study? Y'all haven't decided that? Does it gotta go through like a RFP process
Yes.
and stuff? Oh, okay.
Yep.
All right, thank you.
And it'll be a nationwide search for that provider.
Okay, thank you.
Commissioner McGilvery?
Yeah, I'm just curious why, if we're doing a food study, landscape study, but yet we just appropriated $850,000 for the one above this, the item above this. How was that happen?
Commissioner, the previous resolution was more so based on an emergency need, something that could be done immediately, like a Lighthouse and in Oakland Hope, they could provide and distribute food immediately. This study will look at a more long-term strategy for how do we resolve this issue and study this issue long-term so that we won't have to have like these emergency needs and requests and things. This strategy will allow us to develop something that we can look at long-term on how do we address these issues.
Okay, just one other comment, and that is that there's people in every community throughout Oakland County, north, south, east, and west, that are maybe in rough shape. They lost their jobs or whatever it might be, that they can't afford food. And I want to make sure that we're covering all parts of the county, not Pontiac and Southfield and a few of the larger CBTs throughout the county.
Correct.
It's important.
This is covering all of the county, all of our residents who are in need.
Any other questions or comments? All right, prompt the vote, please.
You have 7 yeas, 1 nay.
All right, motion carries. Thank you.
All right, thank you.
All right, next item is a resolution from Health and Human Services appropriating American Rescue Plan Act local fiscal recovery funds for Honor Community Health. I have a motion by Commissioner Gershenson, support from Commissioner Cavell. And we have Leanne Stafford here to explain more about this item.
Yes, hi. Good afternoon now. It was good morning first, so. So this request is a one-time request utilizing ARPA funding from Honor Community Health to create a residency program, so a family physician type of residency program. And so prior to the COVID, we actually were already or Honor and the hospitals surrounding them that they have talked to, really we're already seeing a low level of family physicians that were needed in the community, especially those that had community experience, right? We're actually in depth in the community. Now, as a result of COVID, we're seeing that they're leaving the field earlier than expected, right? Retiring early, there's burnout. And so they really have seen a real need for this type of doctor, this primary care physician. Just for a statistic, Academy of Family Physician expects to see a need for 15% more physicians in the field after COVID, just to keep up with the demand after what we've seen in COVID. So Honor is looking to, like I said, create this residency program. They're looking for allocation of $1 million to kind of jumpstart and operationalize this residency program so that they can, like I said, get it up and running, and they will be looking for and applying for additional funding. I also have Honor here with me, obviously, to answer any questions you have specifically to that. But the goal is to, first thing, they received a planning grant, right, that allowed them to look into and create this residency program. This initial funding will help them jumpstart it and operationalize it, and then also they'll be looking for and gaining additional funding for sustainability and obviously billing in the future. Obviously, as an FQHC, they have the ability to apply for additional grants through HRSA for this that allows them to make this sustainable and a long-term plan. So again, specific questions, I'll turn that over to Honor. Obviously, our guests are here if you all would like to ask them questions, but again, this is...
Oh, Honor, I think you need to come.
That's always a bit scary.
Yeah.
So where would this program be located?
So two places. First of all, I want to kind of update the committee on a change that's happening here in the community related to Pontiac General. We have been working, Pontiac General has been operating a family medicine residency program, the longest one here in Oakland County for more than 30 years. It produces 16 residents every year that go in and work within the community, many of them going over to St. Joe's, St. Lawrence, whatever. And because of COVID, they have really hit a unique financing situation, so they are making a decision to close down their residency program at the end of this year. Now, you're going to wonder, why should we be concerned about that? That is 16 people every year that will not be trained to come into family medicine within this community. So you're already at a 15% low in trying to meet the demand for family medicine practice. So initially, our project will focus on Pontiac so that we keep those residents. That is how we deliver care right now through Pontiac General, through our relationship with community groups within the greater Pontiac area, so Southfield, Pontiac, Auburn Hills as well. Prior to that, we already saw a major shift in terms of being able to get family docs in, and family docs servicing individuals with Medicaid, Medicare, and uninsured. A really good example is McLaren came to us 3 years ago and said, listen, we are losing money on our pediatric practice because it's predominantly Medicaid. So practices that generally serve all of Medicaid patients lose money because the state pays at a lower rate than commercial carriers do. We as an FQHC are obligated to see anybody that walks through the door, but it also allows us to draw down a different kind of match on federal dollars when we see a Medicaid or a Medicare patient. And so that just gives you a perspective of what's happening right now within the healthcare field. So we're starting in Pontiac, but remember, in Pontiac, our two largest practices are out of Pontiac General Hospital right now and out of the Baldwin site, which is right in front of Easter Seals across from Kennedy. Those are our two largest practices. They see 75% from 10 different zip codes. So Auburn Hills, Southfield, Clarkston, Pontiac for sure, Waterford. So we'll see anybody that comes in. This will be the second residency, community-based residency program in the state of Michigan. So right now, Detroit has had one successfully for the last 10 years, where they've been able to train and turn back docs. What is different about this is not a hospital-based residency program. So when you go into St. Joe's or into McLaren and you have residents coming in with the physician, that's from a hospital standpoint. What's unique about this, what I think is great for Oakland County, is that it's community-based. It is focused on working within the community setting. So while it have rotations at the hospital, it will have a rotation at the health department. It will have a rotation at Gleaners to bring in that community health perspective that we know is really, really important to good and long-term health. So you get to be the second in the state to put this program together, the first to put a really strong relationship with the health department together. We were one of only 15 one of 50 across the nation to get funded for a planning grant, and the only one in Region 5. Michigan, Wisconsin, Indiana, they recognize the shortage of family practice physicians in this area. So we're very excited about this. We're asking for this kickstart because we know that the Pontiac General Hospital residency program will be shutting its doors and start to grandfather out those docs. And so we don't want to lose our residents there who are providing care.
How many residents would this program accommodate?
It starts out with, we grow it, starts out with 6, and by year 3, it's a 6, 6, and 6, and by year 3, we're at 18. And then from that point on, you have 18 residents going through the training program.
Thank you.
You're welcome.
Commissioner Hoffman?
Thank you very much.
You're welcome.
What will this money specifically be used for? Will it pay the overhead at the hospital? Will it pay
No.
the residents?
Yes, so let me back up. This is not hospital-based, okay? So I, as an FQHC, think back to several years ago when the hospital was looking at going in through bankruptcy. There was a major concern in this community to keep the residency program that Dr. Hamadi oversees intact so you didn't lose it. Because that practice sees 10,000 patients throughout this community, throughout this county. If that residency program had gone away when the hospital closed, we'd be looking for medical homes for 10,000 Medicaid, uninsured, and Medicare patients. Not an easy feat. So you all partnered, at that time it was George Miller and Kathy Forsley with Community Mental Health, to create this FQHC that would allow us to work closely within the hospital. So our office is located in the hospital because that's where a lot of people come in for care. I've discovered almost everybody's practice, Commissioner, and that's important to know. The funds for this go into 3 things. They go into the wages for residents because they're employees, the preceptors, so docs who train the docs, those individuals, they have to be approved and on the roster. And I'm going to let Dr. Hamadi talk to you about that here in just a little bit more. They go in and they're the ones that guide that resident in his or her education within the exam room on that. And the third is that support for education. So at lunchtime, every single day from 12 to 1:30, they go in for group education. They go pull up unusual situations that they saw in the exam room and diagnoses, and they go in and they talk about it from a clinical standpoint. So we call those didactics. And that is a part of medical education in every single program that is happening. So those are the 3 areas.
Okay, thank you for that.
Janet, mute your, Janet, mute yourself.
What's really ironic about this, I think, is that we're taking American Rescue Plan money, which is federal money,
Yep.
and we're subsidizing Medicare because they don't pay enough. I mean, or Medicaid. Eventually, we have to get to the root of the problem, and they have to up their fees so these people don't go bankrupt, so we don't have to come along. We're subsidizing them, basically.
Well, no, 2 different things. So I agree with you on the Medicare rate. So when I come in to see Dr. Hamadi as a patient and I bill out that visit, whether I see Dr. Hamadi or a resident, yeah, I would agree with you. The rates have got to change, and I think you'll see a big discussion. But this is different. This is a residency training program.
No, I get that. And I
Okay.
appreciate that. I'm just
Okay.
trying to make a point that they don't pay enough fees, and they're gonna go bankrupt if we don't do it, so we're gonna take money and we're gonna subsidize them, basically. But, no, I get it, but it's just
Okay.
kinda ironic to me.
Yeah.
Thank you.
Thank you.
Commissioner Gershenson?
Yeah, well, first of all, I wanted to make sure everybody knew Deb Brinson at the table, and Dr. Hamadi, you didn't introduce yourself.
Yes, thank you.
I'm just so impressed with Honor Health's commitment to the community, and this whole idea of community medicine is so important. Are you saying that you're going to take over the program from Pontiac General, or it's going to be, that's going away, and this is a new program?
This is a new program.
Okay, and because we're losing those 19, and I have to say, almost all my doctors are retiring. It's a very scary thing.
is.
And one of the things our hearings have shown us is that we're hurting in almost every industry. In childcare, we're hurting. In medicine, and in direct care workers. So it appears that this is a really strong idea. I'm excited that you would take this on. So thank you.
Commissioner Powell?
So I just want to be kind of transparent with what I'm hearing in my community. I've met Deb, we've sat and talked, and I just want to put on your radar, and I will be meeting with you because you've been trying to meet with me, but I've had some personal things going on where it's delayed our meeting. But I just want to put on your radar, not saying that I'm a no vote today, but I have not gotten good feedback, and it's been from some of your patients and the staff. But I know things have been challenging with staffing, and just like you brought up with the physicians shortages and stuff like that. So I commend you and thank you for at least just getting through everything that y'all need to get through. And so I just wanted to put that on your radar.
Great,
So you know I've been trying to be supportive and help in any way I can, and we do have a very I have a different community, so I play devil's advocate on both sides, okay?
Sure.
So I just don't go with one side without talking to you first, but I haven't talked to you, and I just want you to know that. But my question is, so we coming off a residency of 16 doctors, even though you all are trying to do 6 for the next 3 years, how are y'all trying to divide that with 6 doctors if they were to oversee that whole 10,000? Usually y'all got 16, so what does that look like? You know, how is that rotation? Because that's a lot and can cause burnout, and then them physicians gone.
Yeah.
Then what do we do? You know what I mean? So I just want to hear what is game plan if something like that may occur, so we can kind of know that too.
Dr. Hodge, you want to address that?
Thank you, Commissioner Powell. Nick Amati. So I've been practicing in the community. I am a product of Pontiac. I trained in Pontiac General, which was back then North Oakland Medical Centers. And I'm one of those very few doctors that has stayed in the community. Okay. I'm very passionate about making sure that our community has very highly trained family physicians. This is the time when especially trust is important. Trust has been lost in the community, and we want to bring that trust back. We want to bring high quality or retain high quality care in our community. So as we transition residents from PGH out of our health system, out of Honor Care, we are also looking at reallocating some of our existing physicians, nurse practitioners, and PA to pick up some of the volume that they would encounter with the residents being gone.
Okay.
As we slowly transition the other residents into place.
Okay.
That's the plan for now.
Okay. Thank you so much.
Commissioner Cavell, followed by Commissioner Nelson.
To what you're saying, Commissioner Powell, I think a big part of what's hard for FQHCs all over the country, and I don't know if it's specifically the case for Honor.
Speak in the mic, Charlie.
So to what you're saying about issues with customer service or delivery of services, that's a problem with FQHCs all over the country because of their underfunding.
Okay,
And,
okay.
So when going back to when I voted no on the new police thing, what I was trying to say more clearly is, if you don't have a job, it doesn't matter how nice the cop is that you talk to, you're still desperate. If you don't have adequate mental or physical health supports because of funding, doesn't matter how nice the cop is you talk to, you're still going to be in a bad situation. If you're depressed, you despair, you have an addiction to something because of that depression or despair, things that FQHCs help address. If the funding isn't there, that's how you prevent crime. A job, adequate health care, good community supports, not policing. So that's what I was trying to say earlier, but that's also a thing that helps with them getting more money.
Okay. Thank you, Charlie.
It's not policing. We're going to talk.
He's my buddy. I understand what he's trying. He's just basically telling me stick, support you all, basically. Thank you, Charlie. I was giving them the support anyway. I just want her to know. Y'all know I am. I'm transparent. I just want her to know because I don't know how soon I'm gonna talk to her.
I know. I'm right there. Don't worry about it.
Is there other funding other than the $1 million for this program?
Yeah, so we're looking at a couple different things. That planning grant that was discussed that sets us up to be able to apply for federal funding, which is ongoing. And the whole intent of HRSA is to make that funding ongoing so that there are residents that turn into physicians that want to stay within communities and servicing Medicaid, Medicare, and uninsured population. We feel pretty confident. We're assigned right now to a HRSA technical assistance person. We've received ACGME certification, which is just like a hospital was, that says as an institution, you meet all of those requirements. We had a great review on that. The next step will be putting in family medicine application. So that's one. That's long-term. We expect that to come out late next spring, and we feel like we'll be in a very good position. The other piece is we've had discussions with Medicaid, with the Medicaid state office. We were able to secure language within the state budget last year that said any local appropriation for a residency-based, a community-based residency program could be matched, and so that language was put in, and we've begun having discussions with Medicaid about taking this $1 million and matching that $1 million to bring in additional dollars to support the residency program piece with that. So that the state has an investment in this, feds have an investment in this, and the county has an investment in that.
So the state will match the $1 million?
We're under discussion right now. Yes, it's not uncommon for that to happen because this is a teaching program. Because they run the state Medicaid program, they need to make sure that there are residents or physicians available throughout the state to be able to see the very population that they insure. So we're in discussions right now with them. They have not said no to this. We are actually, after this week's meeting, we'll be putting together our next step of discussions with them on that.
I think that is a part of a concern from what I've heard from other commissioners regarding other items, is that up to date, whether the idea is a good idea or not, there has not been a standard and fair practice regarding what's needed. It has nothing to do with Honor Community
I understand.
Clinic. But there are some proposals that must have a matching grant, some proposals that are required to do this or that. So the confusion continues on our part as to why a request doesn't have to have a matching grant, but request B has to have a matching grant, et cetera. So
Sure. Makes sense.
thank you for allowing me to vent. Commissioner Nelson.
Thank you, Madam Chair. You gave me a perfect segue. Mr. Dobson, first and foremost, I do appreciate Honor Health joining us, and Leanne, it's so great to see each and every one of you, so thank you. Mr. Dobson, the same questions I asked in regards to the previous ARPA resolutions. Has this been approved by Guidehouse, and are the documents attached if they have been?
It has been approved by Guidehouse. You want me to come to
Oh, sure. Either way, you got a loud voice, so that's good.
Yes.
Join us.
It has been reviewed.
Mike, you gotta sit in the chair.
So it's been reviewed and approved by Guidehouse?
It's been reviewed and approved, and it's not attached because there's some sensitive
So
information.
still incomplete, or is it not being attached?
They're complete. It's not being attached because sometimes they're financial documents or other documents that we may not want to.
Public, I get that.
Exactly. So
Are
that's why it's
commissioners
not
privy to
attached.
that information to have?
I'll have to check with Corp Counsel.
Please
I'm
do.
not sure.
Secondly, is there a matching grant component? Because I'm hearing, and Deb, you gave a good rundown of, I understand that there's a potential of an additional $1 million, but as of today, that's a contingency. I mean, that is, so is there a plan B if the $1 million additionally through federal funds doesn't come through? And if it does come through, is it in addition to the $1 million that Oakland County is bringing forward? So then it's $2 million?
So, yes, well, let me kind of, if it's okay, can I break those down into
Sure.
a couple of things? So, so we asked for $1 million. So to run the first year program, it's $1.8 million to run it. So we're not asking for the full amount. We expect that we'll be able to bill and get some of those dollars in on that. By the second year, it is at almost $2.5 million. That would allow for that local match, just in case we don't have that federal the grant in time for the $150 million. This is not intended to be an ongoing grant. We haven't even asked for the cost of what we call the continuity clinic, where somebody walks in and that continuity clinic is creating the clinical aspects of this. This is just on the educational component of it. So we feel confident on the federal, but until it happens. But my job would be to figure out how to do the ongoing funding without coming back to the commissioners for that $1 million.
So it sounds like there's a potential for a matching grant opportunity.
Yes.
With that
And I
$1
feel-
million federal funds.
Yeah, I feel there are two different things. There's the federal funds, and then there's the run through the Medicaid program. And we've gone through a number of steps right now through the Medicaid program where we're feeling pretty good on that. The next step would be to come in and say, yes, the county has appropriated, what's the next step of that piece of it? And they would have to go into the feds to ask for a way to match that. This is not uncommon. This has happened in Ingham County on other programs. It happens in Wayne County. It happens in Muskegon County. We just specifically asked for a residency program match because there's a line item in the state budget
Thank you.
for that.
And then lastly, is there a sustainability plan for when this money runs out?
There is a various. So our HRSA grant requires us to submit a sustainability plan, which is looking at that federal grant opportunity, also looking at billing pieces of that. Our whole goal is if we can't get residents, and we're going to hire physicians, and that means that they have to be seeing patients, period, on that.
Thank you. And my final question, I think Commissioner Hoffman, you touched upon it a little bit. It sounds like when I open up the budget amendment, Schedule A that's attached, there's no descriptions of anything, yet at the same time, I believe you shared components of how that $1 million would be spent. My concern is that according to the documents that we presently have, there's no details on how the $1 million is going to be utilized, and that's a little problematic given that there's no documents. I heard you, which is great and amazing, but I'm concerned that that information is not reflected in the budget amendment, and the only thing that's reflected on the budget amendment is just the $1 million for fiscal year 2022. So I view this as like it's incomplete if we don't have information on how that $1 million is going to be spent. I heard you, I appreciate it, but I'm also a little uncomfortable voting to support this today without that information within this resolution. So, thank you, Madam Chair.
Commissioner Powell?
So just for the record, I just want to say this honor community, well, this new residency component is to service people throughout Oakland County.
Correct.
Okay, I just wanted that on the record, so we know that we're sharing the wealth with everybody, because I know majority of them from my city, but I just wanted all my colleagues to know this is for everybody, so, okay, thank you.
Any other questions or comments?
That's a good point.
All right, prompt the vote, please.
Commissioner Hoffman? You got 4 yeas, 3 nays.
All right, motion carries. Thank you.
Great, thank you.
Our next item is from Health and Human Services, a resolution appropriating American Rescue Plan Act local fiscal recovery funds for Corktown Health.
You voted no, right?
Who would like to make a motion? Motion by Commissioner Bell, support from Commissioner Gershenson. So welcome back.
Hi, thank you.
We also have a Corktown representative behind you.
So just to give you a basic rundown of the project, so this project is called Corktown Health. Corktown Health Center is the first medical home focused on serving LGBTQ community in Southeast Michigan. They currently have a healthcare center in Detroit. And now they are looking to acquire and build a location in Hazel Park to serve the southern part of Oakland County. A little bit background about Corktown Health. They offer primary health, behavioral health services, comprehensive HIV care and treatment, cancer screening, health insurance navigation, and more. In 2017, or they were established in 1986. They expanded in 2017 to really be focused and on the LGBTQ population. Again, as I spoke, they are looking to acquire and renovate a 17,000 square foot property that's in Hazel Park. And again, this is an increase to access to care, which, as you know, we've talked about this a lot. This is part of our strategic framework, a part of Oakland County. One of the Healthy Residents community objectives is to increase access to care, and so this will definitely be doing that. So the full project is $5 million. However, Corktown Health is bringing $2.5 million to this project, and we would be matching it with $2.5 million to help with the infrastructure. So that would be help with the renovations, for furniture, for applying kind of that furnishings to the operations, and then again they'll bring the $2.5 million as well to help with completing the project. This is a one-time funds. They will, for sustainability reasons, or for sustainability, they will be bringing a mix of insurance reimbursements. They have grant funding and also have fundraising to continue with operations after the project is up and running. It will take anywhere between 12 to 18 months once the allocation is provided to them.
Thank you. Has the building been purchased yet?
It has not, but they're working with the developer or who owns the building. Once this funding is insured, they will be able to move forward with the building.
So a building has been identified?
Yes, they have identified a building,
All
yes.
right, thank you. Commissioner Hoffman?
Just a question, and I think you just said it, but this facility, first of all, thank you guys, and this facility will be open to anybody.
Correct, yes.
So they'll bill Medicare, Medicaid, they'll bill insurance companies.
They'll have access to
All right.
bill all insurances, and it will be available to everyone, anyone that wants to come in, yes.
Thank you.
Commissioner Powell?
Just to get clarity, anyone, because they specifically focus on a certain, but when he say anyone, it's anyone, correct?
Yes,
Okay.
it's-
And then two, I just have a question because Commissioner Nelson keeps asking for this same report, and I'm trying to figure out, in the past, has this report been added to, them documents been added to other? And if they're not at any of these ARPAs, why aren't we getting that same information we've seen with other ARPA asks that has come before us? I'm just asking.
I don't think I've ever, heard a requirement to say, hey, submit the guidehouse documents with the resolution. I have no issues with, the guidehouse documents, though. I mean, that's, to me, that's something that we fill out, as part of our compliance, that we turn over to the feds. I have no, hesitation about giving you the guidehouse documents for any of these projects. So going forward, if that's a thing that you want to have,
I was just asking, and then with that, it's a two-part though. So it's guidehouse documents, and then she keep referencing some budget. Only reason why I'm asking, because I'm gonna be honest, it's a lot for us to read, and if it has, all our commissioners do their part, and if it has been on other stuff, I was just asking for record purposes, for clarity. But she also referenced the budget. Now, I've seen that before in other things. Is that the same case?
Is that the leverage
Or which one
piece that you're talking about?
The Schedule A's that are attached to the ARPA resolutions, there's not a breakdown of how the money is going to be
the
spent.
fiscal piece.
So it's in good faith.
So I was just asking.
So I'll make sure that you have it.
Okay.
Again, that's not something that, I was asked to kind of bring with the resolutions, or even as we're submitting these resolutions, and this is only me. Now, somebody else, another deputy or another director could definitely be doing this. I don't know. It's not been
Okay.
uniform in our shop.
Got it. Okay.
As I submit information, to, commission staff, I've never personally got an email back to say, Rudy, I need this too.
Okay. All right. I just wanted to get that on record so we know. Thank you very much. And then also, I know Mr. Dobson was alluding to that some information is not for public, so we have to keep that private. And that's
Right.
where Corp Counsel controls that, though, correct?
Yeah, I need to have
Okay.
a discussion with Corp Counsel because especially when you're looking at the full summary, there could be some information that could be
Okay.
confidential. So
Okay.
we could just have a discussion. As Deputy Hobbs mentioned, I mean, we're not, we're happy to share information
Got it.
and things like that. We want to make sure that we're not compromising maybe
Corp counsel say you
information.
can have it.
Okay. Yep. And that's fine. I just wanted clarity. Thank you so much. Thank you for clearing that up. Thank you.
Commissioner Nelson, followed by Commissioner Cavell.
Thank you, Madam Chair. I just want to clarify one piece of information that Commissioner Powell had brought up. Again, a budget amendment should be attached to all of the resolutions that have a dollar amount. That is not a choice. That's what the resolutions are being brought forward with a dollar amount. Within the Schedule A's, the budget amendment, it is not uncommon to get an itemized how the money will be spent. So I appreciate, Deputy Hobbs, what you've shared, but I also disagree with it because when we're bringing high dollar amount items to committee and expecting a vote to be taken, I view it as an incomplete vote because while I read the $1 million might be going to X, Y, and Z, I don't see that reflected in the budget amendment. So therefore, I don't know how that money is being spent. And as an individual who sits on this commission, it's my responsibility to make sure that I'm looking at the fiscal aspects and how things are being spent. That's not a choice. That's my job and responsibility as a commissioner. So again, I've said this in previous ARPA resolutions that we've already heard today. I view it as an incomplete Schedule A budget amendment because there's no information on how the money within this Corktown Health resolution is actually going to be utilized and spent. And to me, that's problematic. It's not that I don't support this idea. I think it's an amazing idea. But I also know that this is, in my eyes, an incomplete document because I don't know how this money is going to actually be spent to bring forward this initiative. So again, I want to be very clear. I support the concept. I support the idea. What I'm not okay with today is taking a vote on something that I deem as incomplete because I don't know how the money will actually be spent.
No, I can respect that. I think you're absolutely right. I think moving forward, I'll talk to fiscal and we'll have a conversation about making sure that whenever we send a resolution over, that we have a Schedule A, outlines the dollars. But I do think that's a conversation that, I'll have with fiscal, and make sure that we move forward, because I think you're absolutely right.
Thank you. Thank you, Madam Chair.
Thank you. Commissioner Cavell?
Yeah, so two things. One, just to what you're saying, Commissioner, I think the Schedule A is not necessarily the place where you would find the detail breakdown, especially when we're thinking about allocations like this, because what it fundamentally, like from just a government budget best practice thing is just saying there is a code that has all these numbers and digits that talk about where the money is housed, and then it was transferred here or there. And because this is a one-item request, right, $2.5 million for one thing and one purpose, there's only one line item. Same thing with what the Honor Health thing was, right? It's just from one bank account to then Honor Health. So that is partially why a lot of these don't have a lot of detail, because it is for big dollar things that are going to one thing.
So is it a proposal missing?
So
It should have, I think,
yeah,
I
so
appreciate the
yeah, I get
clarification,
you.
which almost
Yeah.
makes it worse, Commissioner, but
Right.
I appreciate the clarification.
So I think it's not like the fiscal department not doing it, it's us as a group realizing that the game has kind of changed midstream, which Ken mentioned earlier, right? That the first 6 months or a year of us having ARPA, everyone was trying to figure out what works best. We're all people with egos and motivations that are all trying to figure out how to work together. And then the executive's office came up with this 6-page form that is very systematized, that it sounds like some of us are still, like, I mean, I think even in this meeting, are like, there's a 6-page form. So I think the breakdown is not in the policy or the worthiness of Corktown or what anyone's doing.
Sure.
It's just what we're saying now, I think that's being lifted up to take back to Hillary and Dave, is let's just talk more clearly about what you want from us to then propose something legitimate, and how can we make that communication and conversation more consistent and fluid? Because what I'm hearing from everybody is it feels lopsided. And so let's balance that out. All it takes is talking, right? Because also the second thing to mention is things like Corktown Health or Honor Health or anything that we saw today. If Oakland County, so this goes to you doing your job thing that you were saying, if Oakland County misspends ARPA, we have to pay it all back. So that means we have an incentive to hold us and our constituents and our executive office accountable for their proposals, and ourselves for our proposals. And that's why Ken's got a serious ass job. But then the second thing is about that is Dave Coulter doesn't want to have to come on the news in a couple of years and be like, hey, everybody, I know you need all this stuff for clean water, or good parks, or quality schools and all this. We had to give back $15 million because we didn't fill out the forms right. So everyone has an incentive to really be on point. It sounds like the breakdown is in communication. So just tell Hillary and Dave to talk to us more, I guess.
Okay, Commissioner Hoffman, followed by Commissioner Gershenson.
I realize this comes to public health and safety first. You make your presentation. Tomorrow it's going to go to finance. Do they get a different presentation, or so you won't have any more detail for the finance people than you had for us? Yeah, I agree with them. I think there should be a little better plan.
We can submit that information. I mean, it's information we have, right? It's literally in the guidehouse application. So we can make sure that, everyone has that information. So particularly moving forward. So my apologies, seriously, didn't want to come here, to offend anybody, right? I think we've come here with the same type of resolutions that that I came with housing, and so, if moving forward, this is the information we want, I'm more than happy to give.
Commissioner Gershenson?
Yeah, I appreciate that, Rudy. It is something that we do hear a lot. We do want to see that budget amendment for sure. But I also want to just take a minute to welcome the gentleman from Corktown. And I want you to be sure, many of us think this is a phenomenal opportunity, and we're very grateful that you're coming into Oakland County. This is kind of a administrative issue that we're dealing with, but I wanted you to be sure and know we do. I personally do really like the idea, and I'm grateful that you're coming into our community.
Well said, Commissioner.
Commissioner McGilvery?
Thank you so much. Thank you. We greatly appreciate it. We're actually looking forward to this. It's something that we believe the community really needs. This is work that we've been doing for a very long time, and we are community-based and community-focused. We think that this will really impact the health of the community in southern Oakland County, and that we will be a very honored and appreciated member of the community there. So again, if you have questions for us, we'd be happy to answer any questions you might have about how we function now and about how we plan to function there.
While you're here, will you introduce yourselves?
Oh, I'm so sorry. I'm Anthony Williams. I'm the CEO of Corktown Health. And to my left is Mike Flores. He's the Chief Financial Officer. And who's not on camera is our Chief Operating Officer, Teresa Roscoe.
Thank you.
Hello, everyone.
Hello.
Well, welcome.
Who had their hand up next? Commissioner McGilvery.
Yes, I'm going to be voting no on this one as well. And the reason being is it's just kind of strange how if it comes from the administration, we do it this way. But if somebody else asks for ARP money, then you have to jump through a bunch of hoops to get there. And so I think we need a better process on how this is handled, and I don't see that in this situation, so I'll be voting no.
Commissioner Nelson?
Thank you, Madam Chair. I just wanted to follow up on Commissioner Cavell. I appreciate the breakdown because I think I know you're absolutely right. The budget breakdown component, fiscal services breakdown, it comes down to the proposal. And Deputy Hobbs, I know myself, you and other commissioners over the course of the past now almost 2 years have sat through the same meetings and have made the same requests that if we're bringing something forward, let's have it be a complete proposal. I get it, it's gonna change, it might be modified, we might hear some really great ideas that we wanna bake in and input into the proposal. But at the end of the day, the one thing that is missing from all the resolutions that are brought forward today in regards to ARPA is a complete proposal. I read through the resolution how much money we are looking at appropriating and what the idea is, but in every single one of these resolutions, what's missing, in my eyes, is the most important part, and that's the how. How are we going to do all these great things I'm reading in this resolution? It's the how. That's where the magic happens. And I have yet to see a proposal, let alone a complete proposal with these ideas. So I apologize that I'm frustrated, and I'm hopeful still that as we proceed to move forward and looking at how we can utilize these ARPA dollars to help people, that we will continuously get better at coordinating, collaborating, and communicating, and coming to the table with an actual plan and proposal on the how we're doing all these amazing, great things. So thank you, Madam Chair.
Thank you. Anyone else? All right, it is time to vote. Okay.
You have 4 yeas, 3 nays.
All right, motion carries, thank you. We have 2 items left. We've been at this for 2 hours and our committee is shrinking, but we'll do the best we can.
Keep on leading us.
Our second to last item is from Health and Human Services, a resolution appropriating American Rescue Plan Act local fiscal recovery funds for the Double Up Food Bucks program. Would like to make a motion. Motion by Commissioner Cavell, support from Commissioner Nelson. All right, welcome back. What would you like to tell us about this program?
Good afternoon again. So Double Up Food Bucks, and I'll try to be quick. Basically, this helps people get food access by matching SNAP contributions for fruits and vegetables. As we all know about SNAP, SNAP definitely helps provide nutritional benefits for low-income families. However, it can be difficult sometimes for those families to actually purchase fresh foods and fresh vegetables. So what this program will do is it will work with the Fair Food Network, which is a national nonprofit organization that aims at providing healthy food access to residents. So what this proposal will do, the county will, the Health and Human Services Department will subcontract with the Fair Food Network to recruit 3 additional Double Up Food Buck sites inside of Oakland County. Currently, there are only 5. So we want to recruit 3 new sites in Oakland County so that we can provide this service. Secondly, we want to work with 2 of the current existing Double Up Food Bucks vendors to expand their operations to include online purchases for the Double Up Food Bucks program and also SNAP. The third thing is to upgrade the point of sale systems that are needed to administer both of these programs. Lastly, this program will provide incentive dollars for families who are shopping at Oakland County sites. You look at why we're looking to do this, we want to increase the healthy eating behaviors of SNAP residents and people from low-income backgrounds, which can reduce the chances of COVID-19 and other health issues that are a reflection of a poor diet.
Is this designed more to work with farmers markets? Where are you at now?
It could be either grocery stores or farmers markets. We currently have, I think, 3 farmers markets and 2 grocery stores in Oakland County that currently are part of the program.
Yeah, who are the grocery stores?
Glory Foods in Oak Park and Western Market in Ferndale.
Thank you. I've organized a farmer's market since 2009, but what I hear from the farmers, that they're not interested in participating because the paperwork is too much. So my market does not participate, and I have not had any luck with that. And I don't know what the documentation includes for that. So, Commissioner Gershenson.
Well, I have also worked with many farmers markets, and it took a long time for the Oakland County Farmers Market to accept it, but they do now, and it's been a really successful program. The farmers are on board, so maybe we could arrange some sort of communication, because they were against it in the beginning, too.
Thank you. Commissioner Nelson.
Thank you, Madam Chair. This is an amazing program. It truly is, and in this day and age with rents doubling, food doubling, gas doubling, it is so important that people have access to affordable, fresh, and healthy food. My only question is, why 250,000? Why not more? Where did we come up with that number at?
We worked directly with Fair Food Network to come up with that number, just knowing their capacity and how much it kind of what we've spent in Oakland County previously, and then what kind of we could build up to move forward and increase it.
Well, not what we spent, but what has been spent in Oakland County.
Right, yes, what they spent in Oakland County, what they reimbursed funding for in Oakland County Fair Food Network.
Commissioner Powell.
Thank you.
Now, this, Commissioner Gershenson stated that this is the same double bag program that's at our farmer markets and stuff. I just wanted to go on record and say then, I was just making sure I clearly understood that it's that one. I do know my residents in the city of Pontiac does take benefit of this program, and I just want to thank you all for bringing this before us. Well, at least for that area down there, but thank you.
Thank you.
Any other comments? All right, roll call, please. Prompt the vote.
Oh, Marcia got a vote. Hurry up, tell them.
You have 68 0 nays.
All right, motion carries. Thank you.
Thank you.
Thank you. All right, our last scheduled item is, a resolution appropriating American Rescue Plan Act local fiscal recovery funds to create the Oakland County Schools Mental Health Grant Program to address students' mental health needs in Oakland County Public Schools. I have a motion by Commissioner Cavell, support from Commissioner Gershenson. I would like to say this is something we've been working on since August of last year, so.
Lord Jesus.
Moving on to a year, yes. The end product is a compromise through many different opinions. So this will develop a grant program to provide each Oakland County School District a base grant of up to $175,000 to hire a licensed mental health professional in their school buildings. There will also be an additional grant funding amount up to another $175,000 if matched with equal funds. But it's up to $175,000. So if a school district decides that they're able to afford $20,000, we'll match another $20,000. If the school district can afford $175,000 in addition, we'll match the $175,000. Initially, each school district will receive $175,000 without a matching grant, but monies above and beyond that will require a matching grant. Commissioner Powell.
Is this for all schools, or is this just for, it's a public schools? It's just for the public schools through Oakland schools? Not the charters, not none of that, right?
Well, charter.
So
is
no
a public
charter, no.
school. A charter is a public school through Oakland schools.
So it is for the charters, it is for our public schools, but it's not for private?
Correct.
Okay, I just wanted to clear that for the record. All right, thank you.
Commissioner Gershenson.
Yeah, I just have to say that this resolution coming forward, it's been a long time coming, and I really want to commend Commissioner Lubes for her patience and diligence, and also the ARPA team. because this is a great compromise. And this is an example of the detail that we put into this effort, and it took a year. And I'm introducing my child care tomorrow. It took a year. So some of our resolutions have just taken so much effort and so much work, but this is a great outcome. And I'm really excited that we're going to be able to put the resources into mental health. One of the number one concerns that's come out of this amazing pandemic experience we've all had. So I just wanted to say we've criticized the process. This is where the process really worked.
And I do want to add that there will be an oversight committee made up of 2 Oakland County commissioners. Well, it's actually 3 Oakland County commissioners, 2 from majority, 1 from minority, and 2 representatives appointed by our Oakland County exec. So there will be oversight for this program.
Great.
Commissioner Cavell?
I wanted to say the same thing Marcia said, basically, which, right, we were complaining, and that's very valid because of the frustration of a year of banging your head against the wall. But that's, right, setting up a process. But hats off to you, Penny, way to go. And I see this also as a great crime prevention strategy, too. So.
Very true. That is very true. Commissioner Nelson?
Thank you, Madam Chair. To echo my colleagues, I truly admire your patience and commitment and dedication to this resolution. Mental health has always been an issue and a concern and a top priority in schools. And in light of a lot of the world events and things that are just happening within our own backyards, this is an important resolution. We need to do better at how we make sure we are equipping children and students of all ages with strategies and coping mechanisms to make sure and do our part in making sure that we're raising and bringing up healthy individuals in our communities across Oakland County. So thank you for all your work. I know Rudy, administration, and the ARPA team, I know you've been a big player in this over the past year, and I think it's almost like a past year and some change, Commissioner. So I commend the work and the perseverance and the resiliency of getting this done. So thank you.
Thank you. Yeah, and everyone's right. It's the anxiety and fear a student will exhibit that will prohibit them from any academic learning. And along with the anxiety and fear comes the acting out behavior, which again precludes them from learning. So this will hopefully address it. So our next bright idea will be tutoring.
Madam Chair.
It's coming. It's coming.
Thank you. Any other comments or questions? Prompt the vote, please.
I did have a question.
Oh, Commissioner
Just,
Powell?
they gonna notify the schools and stuff, right? They gonna do a
We've been
mass mailer and stuff about this?
We've been working with Oakland
Oh,
County
okay, cool,
schools.
cool,
Yes.
okay. I just was trying to see if we needed to kind of make outreach to our schools or something like that. I mean, I'm gonna do the additional myself, but I just wanted to make sure they gonna know, okay.
You have 6 days, you're on this.
All right, motion carries. Thank you, everyone. So we have completed the items on our agenda and moved to public comment. Is there anyone from the public comment? Anybody want to speak? Welcome.
Ross Barranco, City of Novi. I kind of agree with Commissioner McGilgrave about the drug boxes, the drug kits. You may have people going to the vending machines, taking them with really no intention of using them, and they may be hoarding them up or trying to sell them in a black market or something like that. It seems like there should be some type of oversight on who are able to get these. And the comment was made was that we don't pay for it, but who pays for it then? The state, if the state pays for it, or if the federal government pays for it, it's our tax money. We do pay for it. So to say that we don't pay for it, we do pay for it, and we should be on top of it, like he's suggesting that there may be some kind of control on who gets these drug packets, drug kits, and who doesn't. And on the ARPA stuff, I believe he mentioned, if I heard correctly, that they submitted that information already to the federal government. Why submit it to the federal government and not submit it to the commission that you're requesting funds from? It seems, if you're giving it to one entity, you should be able to easily give it to the other entity as well. Thank you.
Thank you. Anyone else for public comment? All right, public comment is closed, and there is no other business coming before this committee, so we are adjourned at 1:11 PM. Thank you, everybody.
Madam Chair, long meeting, long.